Money with David Blain, a discussion about your money, including everything from investing and taxes to real estate. Now with this week's program from D.L. Blain and Company in New Bern, here's David Blain.
Hello, I'm David Blain, and welcome to All Things Money. For the next 30 minutes, we'll take an educational, stimulating, and hopefully entertaining look at everything about your money. We'll provide you with some actionable ideas and good information that you're not going to hear on other media outlets that'll help you improve your financial situation and preserve or maintain your wealth, or if you're just starting out, hopefully help you grow your wealth. Remember, the show is about you and your money, so we'd love to hear from you. If you have any questions, feel free to give us a call at area code 252-633-0107 or email us at allthingsmoney@dlblain.com. That's allthingsmoney@dlblain.com. And we'll be glad to send you a free copy of our quarterly newsletter for any questions that you may send in. So tonight we've got a great show for you. We're going to talk about the health care reform. We've got some good questions from listeners. But we're going to start off with a few things that I thought were kind of interesting. I did manage to make it through the majority of the 2,300-page health care bill. And honestly, I'm still confused with a lot of the sections and provisions. There are so many new mandates and taxes and requirements. It is phenomenal. If you want to see our government in action, I highly recommend that you get a copy of that thing and read it. How anyone was supposed to vote on that, considering that it wasn't posted, but a couple hours ahead of time, is just amazing. I seriously doubt that 98% of the people that voted on that actually read it, but that's another story. I'm going to try to keep this discussion related to financial topics. Number one, investing. How does this health care reform impact your investings, namely from the corporate standpoint? How does it affect the health and financials of companies in America? And number two, from an individual's perspective, how does it affect an individual's financial planning going forward, either from the aspect of increased taxes or maybe later in life, the benefits of reduced health care cost? Is there going to be any reduced cost? And so we're going to try to keep this perspective of looking at how it either can help or hurt your investments from the corporate side, and then number two, how it may hurt or help you as an individual doing your own financial planning. But first of all, I wanted to talk a little bit about the size of the problem. Currently, Medicare and Medicaid spending in fiscal year 2009 was about 19% of the federal budget. More importantly, though, over the past year, it has risen about 24%. In contrast, defense spending is about 23% of the federal budget, but it has declined about 4.5%. So over the last year, 1 out of every $4 of increased federal spending went to health care already. And this is before anything to do with the health care reform, that health care costs are increasing tremendously. This isn't even the main problem. The main problem is simply one of demographics. And I've talked about this before, using demographics to ascertain broad trends in the economy. One of the broad trends in demographics in the United States is that people are getting older, people are having less and less children. And so we see that currently people age 65 and above comprise somewhere around 13% of the population. This is projected to rise rapidly up to over 20% by the year 2050. At the same time, people in the age group of 25 to 64 is declining rapidly. And those are the people that pay into the entitlement programs such as Social Security and Medicare. People ages 0 to 24 is projected to be about 32% of the population in the year 2050. Once again, a very broad downtrend. And so we have the perfect storm. We have working age people. The numbers are going down. We have very young people babies and children also going down, while at the same time our aging population is ascending rapidly. This is very bad for entitlement programs such as Social Security and Medicare. And lo and behold, look at we have recently, when we hear the health care reform, a lot of the Victoria side were saying that health care reform will pay for itself. Well, the thing with most of these social programs is they end up paying for themselves for a short time, maybe a year or two, but after a long time it leads to massive deficits, and that's what we're seeing with Social Security right now. When it was started, making all these young people pay into a Ponzi system where the older people would draw out without having paid in seemed like a great idea because there were lots of young workers. But anyone who looked at the future of demographics and could add 2 + 2 = 4 would realize that over time the Social Security system would be bankrupt and could not fund itself. For years and years, so-called experts have been predicting that in the year 2016, Social Security's outflows would exceed its inflows. Well, lo and behold, guess what? And this was even as of May of 2009, the Social Security office itself was projecting a 2016 date. Well, just this last month it was shown that this year Social Security will end up sending out more money than it takes in. And so I'm just giving you this backdrop on what's going on in medical spending already, as well as Social Security, so that when we start talking about the health care bill, you can put it in the proper perspective. On a related note, the yields on the 10-year Treasury bonds issued by the federal government bumped above 4% last week. And so, as you recall from earlier lessons, as yields go up, the price of bonds go down, and this is somewhat of a negative thing. And it may be, we need as a government, or as a country, we need rates to stay low because our government has such a massive finance debt that an uptick in rates is going to severely crimp our budget even more. And so, as we've learned, that massive debt, which we've taken on to pay off debt, rarely works out. And so those are two things that we need to look about. Let's start by talking about some of the main things in the health care legislation that happens. The first thing is that the organization in charge of implementing a lot of the new taxes and mandates is our favorite, the Internal Revenue Service, the IRS. And starting right off, this is just a terrible idea. It is so difficult for the IRS to do what they're supposed to do right now. I can't imagine adding even more tasks to their plate. Well, that brings us to our first break, and we'll stop there. When we come back, we'll talk some more about this massive health care legislation. For All Things Money, this is David Blain.